Good morning. My name is Heart-Theeshali, daughter of Mugan. I'm a year 1 medic student. Today I'm going to present an infographic, and my title of the infographic is Heart. Okay, first is anatomy of heart. Okay, first, the heart located in pericardial sac. Pericardium is a membrane that protects the heart. Pericardium makes up pericardial sac. There are two layers in pericardial sac, which are external layer fibrous pericardium and internal layer serous pericardium. Serous pericardium is even more divided into outer parietal layer and inner visceral layer. So basically, this is the outer layer. Which first we're gonna go to fibrous pericardium. Fibrous pericardium is here, and serous pericardium is here. So basically, serous pericardium is even more divided to parietal pericardium, which is here, and visceral pericardium, which is here. And between them, we have pericardial fluid. Okay, so next is the layers of the human heart. Okay, so here we can see epicardium, myocardium, and endocardium. So there are three layers in the walls of heart, which are epicardium, the outer layer, it's the outer layer, and middle layer, which is the myocardium, and inner layer, which is the endocardium. So epicardium is a thin layer connective tissue contain adipose tissue, nerves, and coronary artery and vein. How about myocardium? Myocardium is responsible for pumping action of heart and composed of cardiac muscle tissue. If we last one is endocardium. Endocardium provides smooth lining for chambers and walls of the heart. So that is all about layers of the human heart. Now we move to the third part of our anatomy, which is chambers and walls of heart. So as what we learned in our secondary school and also our during matriculation or asasi is we have four chambers, which are right atrium, right ventricle, left atrium, and left ventricle. So basically, the heart consists of four chambers, which are right atrium, as I said before, left atrium, right ventricle, and left ventricle. These four chambers of the heart work together to pump and circulate blood throughout the body, with the atria receiving blood and the ventricles pumping it to the lungs and systemic circulation. Move to the valve of the heart. So basically, there are three valves of the heart, which are tricuspid valve, bicuspid valve, and semilunar valve. That is all about anatomy. Now we're going to move to the physiology of the heart. So first of all, we have cardiac cycle. Cardiac cycle is a rhythmic sequence of events in the heart involving systole, which is mean contraction, and diastole, which is mean relaxation of the atria and ventricle. It will facilitate blood circulation through the pulmonary and systemic circuit. Three phases, which are atrial, we have three phases, which are atrial and ventricular diastole. We have atrial systole and ventricular diastole. We have ventricular systole and atrial diastole, and also lastly is ventricular diastole. Now, heart sound. How there are two major sounds from the heartbeat described as the lub and dub sound, which originate from the blood turbulence generated from the closing of the heart valve. So each cardiac cycle, there are four heart sounds, but in normal heart, only the first and second sound, which are called the S1 and S2, are loud enough to be heard through a stethoscope. So as I said before, lub we can hear when the tricuspid and mitral valves close, here and here. Meter valve is basically semilunar. Okay, and dub, how we can hear the dub sound is when the aortic and pulmonic valve close. Okay, so when we can hear the lub we can hear during the beginning of systole, and the dub we can hear during the end of systole. Okay, last one is cardiac conduction system. The cardiac conduction system is a network of specialized cells that generate electrical impulse, coordinating the rhythmic contraction of the heart muscles, including the sinoatrial node, SA node, atrioventricular node, AB node, bundle of His, and Purkinje fibers. The contraction of heart is due to the specialized neuromuscular cells as the conduction system. So we move to biochemistry of heart. Okay, so this is the biochemistry of heart. We know that the biochemistry of heart involves intricate process, including energy production through aerobic metabolism, reliance on adenosine triphosphate, also known as ATP for muscle contraction, and the crucial role of protein like myosin and actin in the sarcomeres, highlighting the interplay of biochemical pathways to sustain cardiac function. So, as I said before, proteins like myosin and actin in the sarcomeres. Okay, we know that when the sliding filament theory happens, where is when the myosin head and the actin attached to each other. That is where we can see the contraction of heart, where our sarcomere will shorten, our muscle will shorten, and muscle contracted. So this is the example of myosin actin for cardiac muscle contraction. Like I said, we move to the heart disease. Okay, so disease, we have our main disease is myocardial infarction. So what is myocardial infarction? Okay, basically, myocardial infection, commonly called as a heart attack. Heart attack is a result of complete obstruction to blood flow in the coronary artery. Infarction means the death of an area of tissue because of the interrupted blood supply. Okay, now we're going to see the sign and symptom. I'm going to zoom it. Symptoms is intense pain in the middle of the chest, like you see this animated pictures holding the chest area. Intense pain in the middle of the chest described as choking, constricting, squeezing, crushing, or tightness. The pain generally spreads to the left side, to the left side, right side of the chest, to shoulder and the arm of the side. Occasionally, it spreads to the lower jaw or upper abdomen. The patient may be short of breath and perspiring heavily. Next, we're going to see the risk factors of myocardial infarction. Okay, so we have the atherosclerosis, which is a buildup of fat in the arteries of the body. Okay, or smoking can increase the risk of myocardial infarction. High blood pressure can damage the arteries that are in the heart by accelerating atherosclerosis. Having diabetes where the body is not producing enough insulin causes the body's blood sugar level to rise and hence increasing the risk of heart attack. Using illegal drugs such as cocaine, amphetamines can trigger a swamp in the coronary artery. They can also cause a heart attack. And now we're going to see the prevention of myocardial infarction. Preventing myocardial infarction involves adopting a heart-healthy lifestyle, including regular exercise, maintaining a balanced diet, low in saturated fat and cholesterol, managing stress, avoiding smoking, limiting alcohol intake, and monitoring and controlling conditions like hypertension and diabetes. Like I said, now we're going to see the treatment for myocardial infarction. So myocardial infarction, okay, we have two. First is coronary angioplasty. Coronary angioplasty is a medical procedure to open narrowed or blocked coronary arteries by inflating a balloon within the artery, often accompanied by the placement of stent to help maintain blood flow and restore normal circulation to the heart muscles. So number one is coronary artery bypass graft, also known as a CABG. So the coronary artery bypass graft (CABG) is a surgical procedure that redirects blood flow around blocked or narrowed coronary arteries using blood vessels from elsewhere in the body, elevating reduced blood supply to the heart and restoring normal circulation. So we're gonna see specialization. Normally, cardiologist is a physician who specializes in diagnosing and treating disease or condition of the heart and blood vessels. Okay, if we see, many cardiologists specialize in different areas due to complexity of cardiology. A typical cardiologist undergoes at least 10 years of medical training. This includes 4 years of medical school and 3 years of training without internal medicine. Finally, a cardiologist must undergo 3 additional years of medical training specific to cardiology. All cardiologists are clinical cardiologists who focus on diagnosis, medical management, use of medicine, and prevention of cardiovascular disease. An interventional cardiologist may specialize in interventional procedures such as echocardiography, balloon angioplasty, and so on. As I said before, balloon angioplasty for the myocardial infarction. Cardiologists focus on treating disease without surgical intervention. Now we're going to see one of our famous practitioner in cardiology, which is Dr. Redmond Burke. Okay, Dr. Redmond Burke is a pediatric cardiothoracic surgeon known for his expertise in congenital heart surgery. He has been associated with Nicklaus Children's Hospital in Miami, Florida. Burke's developed an interest in research. He explored the possibility of using endoscopic surgical techniques for congenital heart disease. He began clinical application in 1992, subsequently performing a series of surgical feats, including the world's first endoscopic vascular ring division, diaphragm application, and thoracic duct ligation. He made a really big name in the field of minimally invasive pediatric cardiac surgery and was recognized as an expert in that field. So that is all about our heart. Infographic of our heart. I hope we are all clear about our heart, and it's all from me. Thank you.